You've likely seen this before, someone wearing a mask but not over their nose. This morning we've learned of a new warning from researchers from the University of North Carolina about this. They found the cells that line the nose may be more likely to become infected with the virus than the throat or lungs.
This morning, we're once again joined live by Dr. Hawkinson from the University of Kansas Health System. So, doctor, I'm sure you've seen this too. Sometimes when you're talking, the mask can come down, and then there are some people you see that just choose to wear it underneath their nose, right? And we've also heard that recently it does protect you a little bit when you are wearing a mask, beyond just protecting other people as well. What do you make of this, that we can get more infected in our nose than our throats? Is that true?
Oh, I think one of the silver linings of this is that there now is so much research into every little aspect of coronavirus, such as, how it gets infected. Are some masks as good as others? Do they make droplets smaller? Things of that nature. I think this is one more interesting point. We know that the receptors that the virus attaches to line the respiratory tract and are in other organs as well, such as the heart, the GI tract, the kidneys. But we especially know it's in the upper respiratory tract and in the lower respiratory tract. I think it's another good point and very interesting, and we've always stressed to wear the mask properly, and that is above your nose and then below your chin and not under your nose, as you had talked about, just for the fact that those are two of the three mucous membranes, your mouth, your nose, and your eyes. So I think wearing it properly overall is going to be the best thing to do. Will it increase your risk more, or is it more susceptible? I think it's an interesting study, and I think we need to continue to look at that as well.
And doctor, we want to ask you about, recovering from COVID-19. If someone waited 2 weeks after their first positive test and they're feeling healthy, how can that person tell if they're fully recovered or if they're still carrying the virus but are asymptomatic?
Yeah, this is going to be a very individualized thing. Again, we've always stated that 80% of the people will not have to seek any medical attention at all and will be home. The CDC certainly recommends that after 10 days after your first symptom, you are essentially, quote unquote, safe to go back into society and stop isolating. I think that all depends on how you are feeling. We know that some symptoms, particularly if you are hospitalized or have severe symptoms, can lag on for some weeks, 6, 8 weeks even. So it just goes to that individual person. How are you feeling? Maybe you can't walk as much as you were, but if you keep continuing to do your exercise, that will build up. Maybe you're still having fatigue or tiredness. Hopefully within time that will go away as well. So it really does boil down to the individual patient and the symptoms that they're having. It will take time. We know that people can go on a long time with these types of symptoms. There's really no good answer other than it is individualized to that patient.
And, you guys were talking about something really interesting related to that on the call yesterday, that how do you know, say you had to get tested for, you weren't necessarily feeling symptoms, but then you get a positive test in some other way. How do you know that you aren't testing positive from an infection that is potentially long gone, 30, 60 days before, or that you're asymptomatic and you're still shedding that virus very recently? I mean, that can complicate things.
That is very interesting. There are studies with the regular coronavirus when they looked at people, and they had 4 definitions of asymptomatic because some people won't even realize they have symptoms, and that's part of the issue here. You may not realize that you have any symptoms. I think I gave the example of a gentleman I saw in the hospital who had a slight cough for 1 day, 10 days before he came into the hospital for something different, but was screened for COVID-19 because he had had a risk factor, he had had contact with somebody with it, and he was positive. So I think people may not always realize about a symptom that they may have. If they are lucky, they won't have any symptoms at all, or will be very mildly symptomatic and get over it. But I think it's a good point to bring up. In that case, though, I think we still need to continue to adhere to the isolation guidelines, which is about 10 days from your diagnosis date. But that absolutely could be true. With any luck, you are one of the majority of people who have no or mild symptoms at all. But until we know exactly when you are infected, it's still very important to maintain that 10 days.
That's so fascinating, and so you just need to quarantine regardless. Thank you very much for talking to us, Dr. Hawkinson.
Thank you, Doctor.
Yeah.
And Dr. Hawkinson will be joining us live again today on 41 Action News on Tuesday. Reach out to us on social media with any questions you may have for him. We'll try to get those answered live on air.